Hello, hello, hello. My name is Angela M. Odom. I am the host of the Better You Leadership podcast, and the founder of the Better You Project brand. I teach women how to lead themselves, others, and also how to manage processes so that they may earn more revenue and respect. I'm also a very proud Army veteran. And today we will just talk about just a question. I'm just wondering out loud if leaders are still talking about COVID-19, right? Because if we were to believe that it's all over, then oh my goodness, this past year and a half has been interesting to say the least. And we have news of recovery all over the place, that the tremendous amount of information we were getting, in March, April, June, July, August, September, October, November, December of 2020, it has subsided greatly, right? It has subsided greatly. Hey, Carrie, good morning. Oh, okay, beautiful 74 degrees, sunny northern Minnesota. Welcome. Welcome to those of you who are listening live on this recording, and those of you who are will listen on the replay. And, as the podcast will be posted, you might be listening, months away from this actual live recording. And so the question on the table, I'm just wondering out loud, are leaders still talking about COVID-19? Like for real. Like, I don't hear a lot of it. And when I go places, I have my cute mask on. I probably have like 100 of them. The paper, the disposable ones, and the ones that you can wash, ones with filters and not. Of course, I'm at home a lot, right, with my family. So when I do go out, it's like the Publix. I go out. I do have a few in-person speaking engagements coming up. I'm actually flying to Michigan next week. I'm going to the USS Silverside Submarine Museum, right? And it's in Muskegon, Michigan. And I'll be there. It's an outdoor event. There will be social distancing, and I will decide which one of those cute masks I have on. Um, you know, as as I determine, what that looks like. But we talked about the safety of the event months ago, and so here we are about to get on the airplane. Once I get on the airplane, I'll be double masked, right? Um, and we'll take precautions. But I was just wondering if um, leaders are talking about COVID-19. And so I just want to go through just a few things. This is not like you better wear your mask. It's not that for me. Like, I'm really just curious as to, what's the status now? How is it doing? So I did a little research, and, I just want to, just talk to you about it, right? So we believe the news reports, the U.S. news reports, COVID-19 is not as great a threat to our life, or, our way of life, as it was, in March of 2020, especially I think the summer of 2020. And here we are, June 2021. I just don't believe that the threat is gone. I just don't believe it, right? It's just still here, lingering. They're talking about variants. And so I'm very cautious. I'm not scared. I'm very cautious. So I think leaders should still make this a big deal. It should be a big deal. Folks are still dying in the US and, my God, all over the world, like really all over the world. So we're going to go through just health information and prevention and self-care, and take a look at some numbers. And that's what we're doing today. And I would encourage you to talk to some folks about COVID 19. I'm not sure if you can see the screen, but this is a worldwide numbers. And, back here in like January 2020, January 2020, right? There was like 32 cases reported of COVID. And you go all the way over here, to December of 2020, and worldwide, it was like 669,000 cases reported. And then you continue to go to April of this year, right? April of this year, and you will see like 800,000 cases reported. And now here in June, the 7-day average on reporting is 382,000, right? And so that's a lot, like all over the world. But what's going on in the United States, right? The United States, we go back to the cases itself. And so we started tracking, we as in our great nation, started tracking these cases on March 2nd of 2020. It was 16. And then that thing started to climb, the average rate in April of 29,000 over a 7-day period, right? And it got to its peak in January of this year, January 2021, right? 21 it was like the moving average, the 7-day average of cases, new cases, was 253,000 cases. And of course, now here we are, June, and the average is 14,000. So that's significantly down. However, guess what? It's still happening. And then the deaths, oh my goodness, the deaths. We're looking at, going from all these people dying to right now to 170 now, like deaths as in June 12th is what's being tracked here, if you can see that. And we've gone, of course, to, so many hundreds of thousands of people dying in the U.S. And of course, worldwide, all the way, people are continuing to die at like an average of 10,000 over a 7-day period worldwide. So what does that, what does that look like for us? Really? So are leaders still talking about COVID-19? So if you're traveling, you should, do the research on the location you will be traveling to, right? That's what I'm doing. I'm looking up Michigan and seeing what the numbers are. And Michigan, they've had some issues, right? So I'll be doubly cautious. And of course, I'm vaccinated. I was vaccinated in March, and still, I want to be careful, right? And so let's go over just a few things, for health information. And this is not me preaching to you. I just want to talk about it. And then you make your own decision of, where you might be and what you might think. And if you're in your workplace, if you are someone's supervisor or manager, then be aware and be conscious. And, just knowing that lots of people have not been vaccinated, right? And lots of people are just like, it'll work itself out. I'm in good health. I don't want to wear this mask, all those things. And those are real things, right, to consider. So, and of course, it affects different people in different ways. So it's infected people. This has had like a wide range of symptoms reported, from mild to severe illness. And I guess, we know, like fever, chills, cough, shortness of breath, fatigue, body aches, headaches. And this is what I found on Google, right? Diarrhea, nausea, congestion of runny nose, sore throat, all those things, right? And then that thing about not being able to smell or taste. I'm like, whoa, hold up. The other day I had to throw up for something else. And I was like, whoa, hold up. So you just need to be, aware of what's going on. So you want to make sure that if you got some kind of persistent pain or pressure in your chest, confusion, you get a little pale, then you might want to go ahead and get some medical attention. And then the best way to prevent this thing, of course, wearing a mask when you're with other people, so if you get some people that all of you all are vaccinated, all of you all have, been quarantined, you're not all over the place, right? You still want to stay 6 feet apart. That's like 2 arm lengths from others who you don't live with. You don't want to avoid big old crowds. And I think it's more like poorly ventilated spaces. And so the more people you are in contact with, the more likely you are to be exposed to COVID-19. So if it's available to you, and I did take my son to his regular appointment. He'll be 16 in a few days, right? And I talked to his primary care provider, and talked about the shots, and the what does that mean for him at his age with his medical makeup. And so the doc says, hey, most likely if any kid receives it, in the big numbers, big scheme of things, they would not be impacted so greatly as an adult would. However, there are some that are, and you don't want to be the small number that is receives it and then have to go through all that stuff. So we're getting his shot, right? We're getting my son's vaccination here at the CVS. So we're going to get that done before the whole world really opens back up. And these variants are all over the place. Just want to be careful, right? And we talked about the side effects and what that might feel like and look like, the soreness on the arm and all those other things. So really we want to continue to avoid close contact with people who are sick. And then if you're sick, take the responsibility and stay away from people, right? That same thing with the flu, covering your nose. It's when you're sneezing and coughing and, making sure you throw the tissue away. Some of the things, to talk about that's preventive measures for COVID, we really should have been doing those things anyway. Washing your hands, staying away from people when you're sick. And so for self-care, I think the big thing I keep hearing is make sure you stay hydrated. And that's what I'm reading. Stay hydrated, which, we should do that anyway. Get our rest. And, might take some Tylenol or something you don't feel well. But bottom line is this whole healthcare thing is important. If you're not feeling well, then go see your doc. Call in the nurse, right? And get some things done. And if you got something that's going on with you, quarantine yourself. Put on your big girl pants, your big girl panties, and quarantine yourself. Do the right thing for other people. So there you go. I just, just wanted to bring that up. Like, our leaders really talking about COVID-19? Because in the US, when I'm listening to the news, it's like, oh, everything is going down. Hospitalizations, visits and stays are going down. The number of deaths are going down significantly. And then there are so many places that are opening up, and so many activities. We're about to hit the big summer months, and like I said, I'm traveling to do a presentation at the USS Silverside Submarine Museum next week in Michigan. And of course, I live in Georgia, so I'll be very cautious and looking at people with the side eye who might be sniffling a cough or coughing or something, like, hey, step away. So we want to make sure that we're just aware that this thing is still out there, and it is, I believe, coming with a vengeance, right? I believe it's coming with a vengeance. I believe that vaccinations are the way to go. That's what I believe, and that's what I've done. That's what I'm doing for me and my family, right? I believe that social distancing is, it makes sense, because really I don't like people all in my space anyway, right? If you're coughing, sneezing, not feeling well, then you should isolate yourself anyway. That just makes sense. So social distancing. And just really quick, I want to just take a U-turn from this conversation, right? So I wrote a new children's book. It's called Gollum's Magical Gamers. And I wrote it, inspired to write it for age group 8 to 12. And I put my son as the main character. And it was initially about, the impact of COVID in the children, these cousins, not being able to see one another because they live in different places, right? And so I wrote the book and I edited it. It's all nice and neat, and the storylines flowing. And then I reached out to children to give me feedback to see if this is something they would say, if this is what they're talking about. And so my one of my nieces has a 6-year-old girl and a 12-year-old boy. And I called to talk to the children, to my great nieces and nephew, right? And my 12-year-old nephew, they're not talking about COVID. So I took that out of the book. It was like, it's still the same concept of cousins not being able to get together. And, the whole storyline just goes to how they're able to get together. And they're going to be inside of a video game, working, communicating, working teamwork. And they are going to fight to go to 3 different levels, on the video game. They're inside. So 3 levels. Once they clear those 3 levels, of course, they get to return to their rightful place. And the whole point is, will they do it? Will they work together? Will they communicate to get it done? And so the bottom line is, COVID-19 is not a part of children's conversation. So I took that out, right? I took that out the road. And then I before I did that, I called my other niece, who has a 2-year-old, 4-year-old, and a 10-year-old boy, 2 girls. And I talked to the 10-year-old boy for about 45 minutes. They live in Texas. And after talking to him, again, the language I was using with COVID-19 or global pandemic, those kids don't use those language. They all I know is they have to not be so close to one another. They can still, they still hug folks, so those types of things. So the language. So our leaders still talking about COVID-19. Well, in my nieces and nephews' mind, it is not something that they are addressing every day. However, in their school life, of course, this summer, they recognize that things are different, but our leaders still talking about COVID-19. Well, you and our leaders. So recognizing symptoms is a good thing, and discussing it, have policies and procedures in place is a good thing. And then, of course, you want to enforce those standards and be consistent with everyone, as with any policy or process or procedures you might have in place. Hey, Mo, I see you. So you want to be the model for how to conduct yourself over this next probably 2 or 3 years, right? Probably like 2 or 3 years. All these other countries out here are just beginning to get the vaccine, like in large quantities. They will over the next year. And so until then, people still flying out in and out of the country. They're still flying in and out of your state. They're in your city right now. Someone right this minute, somebody is suffering from this variant, this virus right now, as are they suffering from other illnesses, right? So it's not just COVID-19. It's not just that. So be careful and wash your hands. Wash your hands. Wash your hands, wash your hands, wash your hands. And just be careful. And oh, by the way, we're going to still have fun. We're still going to live life, and we're going to lead our way through this. With that said, I'd love to invite you to attend the next round of the Women's 3-Hour Leadership Intensive. It's on July 10th. So just go to angelaodom.com. And right there on that page, you just go and click the button, and it'll take you to a screen, and you'll be able to register to attend. It's from 10 a.m. to 1 p.m. All my times are Eastern time, right? Eastern Standard Time. I live on the East Coast, live in Georgia. So go to angelaodom.com, ANGELA ODOM, all together, .com, COM, and go to that page and register to attend the next round of the Women's 3-Hour Leadership Intensive, so that you might gain a different awareness of your leadership level, right? And then we'll come out of that thing with your own personal leadership plan, what you want to do next, right? All right, with that said, my name is Angela Odom, and as always, I am rooting for you. You all take care.